You've heard us talk about the HCG diet, also known as the pregnancy hormone. But before you start this diet, it's important to know all the facts, and that's why we took a trip to Highland Pharmacy. Good morning, Marcia and Dr. Rowland. How are you?
Good morning.
So last time we learned all about HCG, pregnancy hormone, which helps people lose weight. Tell us a little bit about your background and how you help administer that.
Well, I'm a family nurse practitioner, and I use the HCG weight loss to help patients lose weight. HCG is an acronym for human chorionic gonadotropin. It is commonly known as the pregnancy hormone. During pregnancy, HCG helps mobilize fat from the pregnant woman to the fetus to help it grow.
Right.
In non-pregnant people, low doses of HCG help them lose weight in the same fashion by mobilizing fat so they lose weight.
Okay, and I think it's really important to stress to our viewers, which, we barely touched on last time, but today I really want to emphasize that it's important for viewers to get, or anybody really, to get their HCG from a pharmaceutical medical provider.
Right. So oftentimes we do see the over-the-counter HCG, and it's just not, substandard. There's no HCG in it. It's an illegal product.
It's not real.
It's not real, right. There are also companies out there that provide it in their office, so they're mixing it in their office, which can be dangerous for the patient. So it's important to also go to a registered pharmacist to have a good, reputable product.
And I understand you're with also the Luma program.
Luma HCG is a company that specializes in HCG weight loss, and we're on the cutting edge. Historically, patients have had to go to a provider who's experienced with HCG weight loss. Now we're using telehealth to help us get to patients who can't make it to a provider that's in a larger area.
So you don't have to live in Albuquerque?
That's correct. Luma has a website, Luma HCG, and from that website you can talk to a consultant and they will get you in touch with a medical provider over Skype.
Now if you do live in Albuquerque, you can come here to Highland Pharmacy and tell us the different ways that you administer HCG and give us some examples.
Right, okay, so HCG with a prescription from your provider would be administered injectable, so either in subcutaneous in the fat or in the hip. But for those patients who are afraid of needles, we also administer it in a topical dosage form. So it's something like this. It's like cream or lotion base. You just have to click it 2 times, and then you pull it off and you rub it in your arms, and there's your HCG for the day.
And it goes straight to your bloodstream.
Correct.
And how safe is it, Marcia?
It is safe. Now, HCG is controversial in that there hasn't been a lot of clinical-based studies supporting it. There have been a number in the line currently, but we've been using it for 60 years.
That's amazing. And here at Highland Pharmacy, you have confidence in the product.
Absolutely. We've been dispensing it for over 3 years. We've been working with Luma for many years, and very good success.
So it's important that it's prescribed. Correct. And that you know exactly where it's being compounded.
Correct, and then it's being monitored by a healthcare professional who understands the program.
Marcia, any tips for our viewers when it comes to using HCG or Luma?
The most important thing to remember about HCG diet is that you get it from a provider who is experienced in it, and that you get it from a licensed pharmacist with a prescription with your name on it.
Excellent, such as here at Highland Pharmacy. Thank you so much, ladies.
Thank you.
If you're interested in learning more about the HCG diet, you can contact Luma at 888-7592 or visit them at 6565 America's Parkway, Suite 200. And the pharmacist at Highland Pharmacy can also give you useful information. The pharmacy is located at 717 Encino Place Northeast.